Kidney failure, also known as renal failure, is a condition where the kidneys lose the ability to filter waste and excess fluids from the blood, which can lead to dangerous levels of waste accumulating in the body. Symptoms of this disease can range from decreased urine output, fluid retention, leading to swelling in the legs, ankles, or feet, shortness of breath, to fatigue and weakness due to the buildup of toxins in the bloodstream. Additional symptoms may include nausea, confusion, irregular heartbeat, and chest pain or pressure. Treatment typically involves dialysis, a medical intervention that artificially removes waste products and excess fluid from the blood, or in severe cases, a kidney transplant. Risk factors for kidney failure include chronic conditions such as diabetes and high blood pressure, recurrent kidney infections, and prolonged obstruction of the urinary tract. Here are the detailed aspects of kidney failure and its subsequent treatment with dialysis. Etiology, acute versus chronic. Kidney failure, whether acute or chronic, has distinct etiologies demanding specialized clinical approaches. Acute kidney injury, AKI, often results from sudden, severe stress, like trauma or toxins, disrupting kidney function rapidly. Conversely, chronic kidney disease, CKD, stems from long-term conditions such as hypertension, diabetes, or hereditary factors that gradually impair renal function. While dialysis can temporarily substitute for lost kidney function in both instances, treating the underlying cause of AKI may lead to a full recovery. However, in CKD, dialysis or a kidney transplant often becomes an enduring necessity, as the damage to the kidneys is irreversible, underscoring the critical importance of early detection and management of the conditions that may lead to CKD. Onset of treatment, immediate versus delayed. In the context of kidney failure, the timing of initiating dialysis is crucial. Immediate treatment is often necessary in acute kidney failure, where the condition is sudden and potentially life-threatening. The body could rapidly accumulate toxins and fluids, leading to dangerous electrolyte imbalances that necessitate quick intervention through dialysis. On the contrary, chronic kidney disease patients might maintain a state of equilibrium, allowing for a delayed onset of dialysis. In such cases, careful monitoring of renal function and proactive management of diet and medications aim to prolong kidney health and delay the need for dialysis. The decision of when to start dialysis in chronic cases is complex, involving considerations of patient symptoms, quality of life, and kidney function metrics. Delaying too long could result in debilitating symptoms or emergencies, while starting too early might expose patients to invasive procedures without significant benefit. Treatment nature, biological versus mechanical. Kidney failure, a severe loss of kidney function, necessitates intervention to perform the filtration usually done by healthy kidneys. Treatment can be biological, involving a kidney transplant, where a donor organ replaces the diseased kidney. However, this option depends on donor availability and a recipient's compatibility, also requiring lifelong immunosuppression to prevent rejection. In contrast, dialysis represents a mechanical solution with machines cleansing the blood. Hemodialysis uses a dialyzer to remove waste, while peritoneal dialysis employs the patient's peritoneum in the abdomen for filtration. Dialysis is more readily available, but can be burdensome due to the frequent and long-duration treatments, impacting patients' quality of life. Patient autonomy, dependent versus independent. When kidney failure reaches a stage where dialysis becomes necessary, the shift in patient autonomy is significant. Individuals who were previously independent may find themselves reliant on a machine to perform their kidney functions multiple times a week. This can lead to a profound psychological impact, as patients adjust to a new routine that often requires meticulous scheduling for dialysis sessions. The dependence on a medical regimen can be daunting, with personal schedules and lifestyles having to be realigned. For home dialysis, training must be rigorous to ensure proper self-care, fostering some level of autonomy, but for in-center treatments, dependence on healthcare providers is unavoidable. This reliance can affect a patient's sense of control and self-efficacy, which is why emotional support and a comprehensive treatment plan are pivotal to maintaining not just physical health, but also mental well-being. Prognosis, potentially reversible versus lifelong management. Kidney failure marks a critical juncture where the kidneys can no longer filter waste from the blood effectively. When it's acute, the possibility of a reversal exists depending on the underlying cause. Quick intervention may restore kidney function to normal or near normal levels. However, chronic kidney failure, a gradual loss of function, leads to irreversible damage. Dialysis steps in as a life-sustaining treatment, performing the kidney's filtering role, but it's typically a lifelong commitment unless a kidney transplant becomes viable. The prognosis radically shifts based on whether kidney damage is acute and reversible or chronic, necessitating continuous dialysis or transplantation for survival.